I was lucky enough to co-found Genome Medical with Randy and Lisa because there was a tremendous need for genetics expertise that was not being met.
So I thought this was so important because I've personally seen firsthand, both for myself, for family members, for friends, how the power of genetics and genomics can unlock new answers.
So the notion of a telemedicine practice, a telemedicine service that could actually reach anyone, anywhere, seemed like such a natural idea, seemed like such a winning idea.
We could see that we were really going to drive down the cost of genetic testing, but that the medical community really didn't know what test to order. They weren't sure what to do with genetic information. They weren't sure that when it was appropriate. And so really felt like the world suffered from a last mile problem, that we can have all this great technology, but if you can't get it to patients and physicians in a way in which they can really utilize it, you've got a gap. So the idea of a nationwide telegenetics medical practice just made complete sense.
When I look back, there's just a lot to be proud of, but it often really comes back to the team and the mission that we're on and how we as a collective group are working to make that mission a reality every day.
If you ask me what of the successes are the most significant, I would say really building an organization with great people that really care about patients. So what am I most excited about the future of the company? I think we're just in the very earliest days. We're really just getting infrastructure built. We've got a great one-on-one infrastructure, a great medical team, great genetic counselors. We're starting to build some great technology products. I think the future is all ahead of us.
So here we are 5 years into the history of the company, and I think I've been thrilled with how we've been able to meet the demand with really quality care. It's been very gratifying to see patient after patient story come in, to have healthcare systems seek us out because they're perceiving us as responsible and responsive, to have laboratories want us to be their sort of interface between them and the public.
And I couldn't be more excited at the thought of this high-tech, high-touch world that we drive, and moving from just trying to get people tested to a day in which everybody gets tested routinely. And the role of Genome Medical is really then the follow-up downstream of here's what you do next.
We are here to bring genomic-based medicine to patients all over the country, and we're going to keep working to make that happen until we succeed.